Hi, I'm Dr. Arti Thangudu. I'm a physician who focuses on diabetes, thyroid, hormones, and other metabolic diseases. Thanks so much for being here. Please don't forget to like, share, and subscribe to help me get the message out on evidence-based endocrinology. We are in the midst of our male hypogonadism series, so if you haven't watched already, please watch our videos on what male hypogonadism is and what the diagnostic workup for male hypogonadism is. Today we're going to talk about the different types of treatments for low testosterone and what you should be screened for before you start testosterone therapy. So first, what kind of therapies are out there? Well, the FDA approved therapies that we have out there are testosterone injections and testosterone gels. We also have testosterone patches and buccal testosterone. A newer mode of testosterone that has been FDA approved is intranasal testosterone. There are several other formulations that are used out in the community that are not FDA approved. These aren't FDA approved due to lack of data on safety, efficacy, and bioavailability. That means we don't know if they're safe, how well they work, and how well they're distributed and absorbed by the body. These include testosterone pellets, which are very popular these days, and creams and oils that are compounded by different pharmacies. There's some confusing language on websites by clinics who prescribe testosterone pellets on FDA approval, but per the FDA, they are not approved, and I'll link the FDA press release on this below. Before starting testosterone therapy, there are several things that should be screened. First, you should have blood work, of course, with an accurate diagnosis of low testosterone, but there are some other things that we want to make sure are okay, specifically related to testosterone. First, we want a CBC to check your hematocrit is low enough to tolerate testosterone. Testosterone can increase the hematocrit or thicken the blood. You also want to be screened for obstructive sleep apnea. If you snore, you should have a sleep study done before starting testosterone because testosterone can worsen polycythemia that can also be exacerbated by obstructive sleep apnea, and testosterone can also worsen pharyngeal hyperplasia, which can worsen obstructive sleep apnea. You also want to be screened with a PSA or prostate-specific antigen and have a prostate exam before starting testosterone because testosterone can cause growth of the prostate and can cause growth of prostate cancer. We also should be screening for a family history of prostate cancer. You should also be screened for history of cardiovascular disease. Testosterone can worsen cardiovascular disease like heart attacks and strokes. So, testosterone is not a benign therapy. However, it is very useful in people who are good candidates for it. We need to be careful in assessing risks and benefits and making sure that the benefits outweigh the risks and that patients are educated about the potential risks before starting testosterone therapy. We should also be using therapies that are FDA approved to keep our patients safe and ensure that we are providing effective therapy for their condition. I hope this video is helpful. Please don't forget to subscribe and share with anyone who you think could benefit. Thanks so much for being here and see you next time.